Hello and welcome. This is our video on breastfeeding physiology by Brittany Rath and Emma Manti. Our learning outcomes for today are breast anatomy, physiology, lactogenesis, what is human milk, nutrient needs, side effects of breastfeeding, benefits and contraindications of breastfeeding, cultural influences on infant feeding, and support for breastfeeding mothers. So a little more in depth of breastfeeding. Female breasts consist of lobes that are made up of fat and connective tissues that are well supplied with blood vessels, lymphatic vessels, and nerves. Within each lobe is granular tissue consisting of alveoli, the milk-producing cells surrounded by myoepithelial cells that contract to send the milk forward to the nipple during milk ejection. Each nipple has multiple pores that transfer milk to the suckling infant. Within each breast is a complex intertwining network of milk ducts that transfer milk from the alveoli to the nipple. Through this, the milk ducts dilate and expand at milk ejection. The nipple and areola are very elastic, so they can be drawn fully into the infant's mouth for a deep latch-on. Breasts come in all shapes and sizes, but that does not tell us about how a mom will breastfeed. However, most women can lactate. A small percentage have insufficient granular development to breastfeed an infant. This does not mean a mom will not be able to breastfeed. They may just not be able to supply enough quantity to meet the nutritional needs of the infant. Lactogenesis. After a mother has given birth, the progesterone levels will start to drop. This will start to trigger the release of a hormone known as prolactin from the anterior pituitary. Prolactin is what prepares the breast to secrete milk while pregnant, and during lactation it will synthesize and secrete milk. Prolactin levels are at the highest the first 10 days after birth and will gradually decline over time. Oxytocin, another hormone essential to lactation, is triggered by an infant as they start suckling upon a nipple. This will trigger the production of oxytocin from the posterior pituitary that is prompted by the hypothalamus. This hormone is responsible for the milk ejection reflex, known as MER, or the let-down reflex. You may have heard of this hormone once already, as this hormone also helps women during labor for uterine contractions and also helps in the uterine contracting after birth to decrease the risk of postpartum hemorrhage. This is done by the myoepithelial cells surrounding the alveoli respond to oxytocin by contracting and sending the milk forward through the ducts to the nipple. The milk ejection reflex, or MER, will be triggered multiple times throughout feedings. This can be done through the mother when they hear, see, smell, or thoughts will trigger MER. Other times this can occur is through sexual activity, because oxytocin is released during orgasm. However, this reflex can be inhibited by fear, stress, and alcohol consumption. Lactogenesis happens in stages. Stage 1 begins during pregnancy, where the breasts are preparing for milk production by producing prepartum milk or colostrum. Stage 2 begins with birth, where baby will receive colostrum, which is a clear yellowish fluid that is rich in antibodies and higher in protein but lower in fat than mature milk. These hormones are referred to as the mother hormone, as they affect women's emotions, which is why women can sometimes feel thirst or relax during breastfeeding. Lactating breasts are never completely empty. Milk is constantly being produced by the alveoli as the infant feeds. Milk production is known as a supply meets demand system because as the milk is removed from the breast, more is produced. So we've added a little exercise for you guys. This exercise is to help stimulate breastfeeding. After completing each stimulation, rate the efficiency of removing the juice from the orange wedge on a scale of 1 to 10. What you will need is 3 orange slices, a straw, and a cup. The first one, you're going to place a straw in an orange wedge and try to suck the juice out. Second one, you're going to squeeze an orange wedge into a cup. And lastly, you're going to place the orange wedge in your mouth using your lips and tongue. Try to suck out as much juice as possible. Between these 3, how much juice did you get and what is the efficiency of the method? As you can see, number 3 is the best. This is a nice demonstration of what infants do to get as much milk as possible during a feeding. So what is human milk? Human milk contains immunologically active components that provide some protection against a broad spectrum of bacterial, viral, and protozoan infections. The major immunoglobulin in human milk is secretory IgA, IgG, IgM, IgD, and IgE. It also contains T and B lymphocytes, epidermal growth factor, cytokines, interleukins, bifidus factor, complements 3 and 4, and lactoferrin, all of which have a specific role in preventing localized and systemic bacterial and viral infections. Within the first couple days, breast milk is mostly colostrum, made up of rich antibodies and high in protein. The high protein level of colostrum facilitates binding of bilirubin, and the laxative action of colostrum promotes early passage of meconium. Composition of human milk changes over time as the infant grows and develops. Fat is the most variable component of human milk, with changes in concentration over a feeding. During each feeding, the concentration of fat gradually increases from the lower fat, or known as fore milk, to the richer fat, also known as hind milk. Nutrient needs for the infant. Fluids. During the first 2 days, infants require quite a bit of water, which is calculated per kilogram of body weight per day, and it continually increases as the infant gets older. Breast milk contains 87% of water, which will easily meet baby's requirements for fluids. Energy. Infants need a big calorie intake to provide energy for growth, digestion, physical activity, and maintenance of organ metabolic function. Human milk provides an average of 67 calories per 100 ml. Fat within the milk provides the greatest amount of energy. Carbs. Newborns have only small hepatic glycogen stores, meaning carbs should provide at least 40 to 50% of the total calories in the diet. In human milk, lactose is the most abundant carb in the diet for infants. Fat provides a major source of energy for infants. Supply as much as 50% of calories in breast milk. The fat content is made up of lipids, triglycerides, and cholesterol. Protein is necessary for infant growth. The protein requirement per weight is greater in the newborn than at any other time of life. Human milk contains 2 proteins of whey and casein. Vitamins. Human milk contains many vitamins, with the exception of vitamin D. One important vitamin, known as B12, will depend upon the mother's dietary intake and stores. So if a mother is vegan or on certain strict diets, the newborn may need supplemental B12. And lastly, minerals. Minerals are typically highest in human milk during the first few days after birth and decreases slightly throughout lactation.
Side effects of breastfeeding. There are several side effects that can accompany breastfeeding. Providing education to nursing mothers is important to try and reduce the risk of these side effects. The side effects include swollen and tender breasts, also known as engorgement. This can be prevented by regularly feeding your baby and expressing milk from the breast. Nipple soreness, an insufficient milk supply, plugging of the milk ducts, and inflammation of the breast, also known as mastitis. Benefits and the contraindications of breastfeeding. Some benefits of breastfeeding include decreased risk of infections and obesity. This can also be due to the antibodies transferred from the mother's milk to the baby. The mother is able to burn more calories and lose her pregnancy weight. It lowers the mother's risk of heart disease and breast cancer and ovarian cancer, and it reduces the risk of postpartum depression. It also leads to a satisfactory bonding experience. Some contraindications of breastfeeding include maternal cancer therapy. If she's receiving any radiation, it can be passed through the breast milk to the baby. Some medications can pass through breast milk to the baby. A tuberculosis infection, herpes simplex lesion on the chest. Galactosemia is when a baby is unable to process the sugars within milk, so they're unable to be breastfed. If the mother abuses any substances, breastfeeding while pregnant can lead to uterine contractions causing premature births, HIV, which can be passed from mother to baby, and the cytomegalovirus infection, which can be passed through the breast milk to baby. Cultural influences on breastfeeding. Women born in low-income countries have higher rates of breastfeeding than US-born mothers. In certain cultures, the newborn is fed on non-milk liquids such as honey until the colostrum is passed, as there are concerns about the nutritional value. Delayed breastfeeding due to cultural beliefs leads to increased formula needs for baby as the milk production in the mother begins to deplete. In some Asian cultures, it is believed that health is based on the body's equilibrium. During the postpartum period, the woman is kept warm to help regain the energy expelled during childbirth. Cold foods are avoided at this time. They believe that an unbalanced mother in the postpartum state will produce unhealthy breast milk for the newborn. Lack of support within some cultures lead to a decrease in breastfeeding and an increase in formula feeding. In some African cultures, it is believed that breastfeeding can lead to needy personalities throughout childhood. Mexican-born women are more likely to breastfeed than US-born Mexican women. There are many ways a nurse can provide support for the breastfeeding mother. Early intervention is vital for providing information on both the advantages and disadvantages of breastfeeding and formula feeding. A new mother and her family may have already chosen which method of feeding they want to provide their child, but it is still the responsibility of the nurse to provide information on both methods. When proper education and preparation is provided to the mother, there is an increased chance of longer breastfeeding times and overall breastfeeding success. While a mother is breastfeeding, it is important to continue to give her praise on her ability to breastfeed. This will help increase her confidence. On the other side, if a woman is struggling to breastfeed, it is important to support her and lead her in the right direction with providing her information to lactation consultants if she is continually struggling to breastfeed. As well, it is still important to provide education to the mother on the overall breastfeeding process, such as baby cues for feeding, which include hand-to-mouth and hand-to-hand movements, sucking motions, the rooting reflex, mouthing, flexed arms and legs with clenched fists held over the chest and tummy. And as well, it is important to assess the latch of the baby when it is breastfeeding. Please feel free to try out our Kahoot to test your newly gained knowledge on the physiology of breastfeeding. If you've left this presentation still having questions, please feel free to email Brittany Rath or myself on Blackboard so we can answer those questions for you.